I'm going to explain the operation of septoplasty and turbinate reduction or turbinoplasty. You'll come into hospital on the day of the surgery, and the surgery is done under a full general anaesthetic. It takes around an hour. You'll stay overnight and go home the next day. I recommend you take 2 weeks off work, sport and study. I'll see you before you leave hospital, a week after surgery, 6 weeks after surgery, and for some patients a year after surgery as well. Before surgery, it's important to stop smoking for as many days as possible. This increases the safety of the anaesthetic. It's also important to continue your medications like Nasonex and saltwater rinses right up until the time of surgery. The surgery is much more successful if the lining of your nose is as healthy as possible on the day of surgery. After surgery, the most important things for healing are to rinse the nose with a saltwater rinse kit 4 times a day for 6 weeks, to eat as normally as possible. The better you eat, the better you heal, particularly vegetables and water, and to avoid any drugs that increase the risk of bleeding, like aspirin, Nurofen and Voltaren. While you're at home, when you're lying flat, the nose will feel more swollen and blocked, and if you sleep and rest with your head elevated, you'll feel better. Pain is usually mild, and most people describe it as like having a head cold. There will be some dissolvable sponges in the nose that you'll rinse out gradually with salt water rinses, and 2 soft pieces of plastic in each nostril. I'll remove these in the office 1 week after surgery. This is not a painful procedure to have done. Surgery doesn't cure allergy or rhinitis, and it's important to know that you'll still need to use medications like Nasonex and saltwater rinses at times in the future. After surgery, it's possible to have a blood nose. This can happen any time from the day of surgery till 2 weeks later. This is why we restrict you from working and playing sport during that time. Bleeding is uncommon. Only around 1 in 100 people will have bleeding, but it can be serious, and I recommend you remain within an hour of a hospital for 2 weeks after surgery so that we can help you if it happens. If you'd like to know more about the surgery, please ask me or my practice nurse, or look at our website.